Hi, my name is Lynn. Today I will talk about for the method. The manager will schedule individually staff 5 minutes of watching a video and then herself to demonstrate the standards training and post the implement of the 6 a.m. inside the pharmacy. The standard training will be done within a week, and during working hour, the manager will show the staff to go to the Fedmeyer main website on the Easy PRN system. Select the WBL option, then choose Act Online, then choose to implement the 6 a.m. training program to watch for 5 minutes on how to improve the performance. The pharmacy manager must type out the expectation of the issues and set up a short meeting with individual to discuss that needs to ask patients personal information, including the patient first and last name and the birth date to match on the system. Before handling the prescription to patient, the pharmacy staff must carefully look through the receipt and the bottle to ensure matching, because sometimes the technician or pharmacist might wrap or fold the receipt and mix it up with different patients. For example, when the patient reaches to the counter and the prescription is not ready, the staff must ask the patient to wait for the few minutes. When the pharmacy staff come back to help the same patient, I recommend verifying the patient information again to prevent the medication from getting mixed up, and do not assume that it is that person and without verifying the information. The pharmacy manager will demonstrate the expectation by scanning stock bottles and labeling properly while training each employee to increase the safety, effectiveness, and efficiency. A lot of staff still do not scan stock bottle properly. For example, the prescription is typed for 2 bottles of 100 ml and amoxicillin medications, but a technician only scans 1 bottle and label on both bottles. In this case, the staff might pull 2 different strengths and totally different antibiotic medication because the drugs are placed very close together on the shelf. If the pharmacy staff overlook this action will no longer provide safety and can harm the patient. The pharmacy manager must discuss with the other pharmacists to monitor all the technicians to ensure they scan all the stock bottles properly by demonstrating how to scan each bottle and hold one label at a time only. Another way that manager can use is teach back technique to ensure that technicians understand a concept correctly or completely by asking staff to scan the bottle while a manager stands next to each employee and then back out the screen to rescan the second bottle of the same drugs. The manager needs to explain this procedure is not just a team building exercise, but it will increase the safety and efficiency to the team. The pharmacy manager must talk with employee and employer corporate staff in order to obtain the online training class video in plain language. The staff must watch it and exercise its principle daily in order to help with a low healthcare literacy, those who do not speak English or who are older patients. The pharmacy manager can schedule each employee to watch a short video on how to handle those customers. This will affect the understanding of how to keep medication and what must be avoided while taking medication. To improve understanding, speaking slowly and use non-medical language to explain things to patients will be a part of this training. There are so many reasons that customers have a problem understanding. These include limited education, language barrier, cognitive impairment caused by dementia, or medication effects, learning disorder or affect disorder. A way that Fedmeyer improved the safety, effectiveness, and efficiency is to teach and train their staff to write down important information. This is important because sometimes customers might have trouble hearing or understand other people's accent. Reducing waste of the equipment and supplier is for the results and discussion section. For the conclusion, the problems are